It's the Slam Dunk.
Health New Zealand is blocking a small group, say 20 to 30 cancer patients, that's maximum, who now qualify for the drug Keytruda. And they're making them wait until the official rollout of the drug on October the 1st. That's despite the drug company coming to the party saying they realise the urgency and they're making it available right now. So the drug's available right now from Keytruda, from the company making it. But the health agency said, no, you've got to wait till October the 1st. To the drug company, well done, well spotted. Thank you for being flexible and bringing the rollout forward. So great. But epic fail to Health New Zealand for blindly, stupidly sticking to the original plan and refusing to see the urgency and desperation in all this. National may have sacked the board at Health New Zealand, but they clearly haven't gone far enough, and the rot within this agency runs deep. This is not a computer blocking access to a drug. This is a person who clearly has no idea what they're doing or can't see the gravity and urgency in this. They're clearly ticking a box. Well, it's simply not good enough. And it can't be allowed to continue and to stand. Surely our hospitals right across the country can cope with administering this drug to another 20 or 30 people. That's why we pay our taxes, and that's why we put more money into health every year. So more can be done. We simply can't accept this decision. To those who are blocking this, get out of the way. People are trying to save their own lives here, and that you can't see the urgency in this beggars belief. Could the bureaucrats and paper pushers at Health New Zealand get this decision any more wrong? If they don't overturn this themselves within the next 24 hours, then I urge the Minister, Shane Retty, to get involved. Make yourself useful and step up and save lives, because this is what this is all about. Cancer patients all have one thing in common. They lack time. The need to make the right decision as early as possible counts. Please, Minister, place your foot up the backside of these nincompoop officials who appear woefully out of touch on this. This is a case study in getting it wrong completely. This is an example of not reading the room. This is a case of not even reading your notes in front of you or hearing the very people standing in front of you. Put this scenario in front of a bunch of 5-year-olds, and I bet you that they would make the right decision here. But this call smacks of an agency lacking in empathy, but most of all, lacking in basic common sense. Blocking the offer from the drug company to fast-track Keytruda to these patients is akin to administering a potential death sentence upon this small group. The drug has been a wonder drug to some people, to some cancer sufferers, and this to many of these patients is their single greatest chance of survival, or at least staying alive a bit longer. To deny them early access when the drug company is offering it to them would seem illegal. We all know it's a stupid decision, but if these patients tested it in court, then surely they'd win. I know what you're thinking, that they're all suffering enough and they shouldn't have to do this, right? But they are doing this. Of course they shouldn't have to do it. These idiots in charge hopefully can make the right decision today, and it must come today. If it doesn't, then, Minister, this message is to you. You've got to step up in order for them to do so. I couldn't care less if it's the right thing for you to do, if it breaks the rules. You are a representative of the people. You were voted in to serve us. The rules are made to be broken, Minister, so do the right thing and sack the idiots who continue to stand in the way of doing the right thing in our health system. New Zealanders, in their hour of need help. What astounds me even more is that such schemes have existed in the past with no problem. Last year, when Keytruda was funded for lung cancer, an early access scheme was set up for 150 patients. So why suddenly can our hospitals not cope with an additional 20 or 30 patients now, right around the country? This is bureaucracy gone completely mad.
Duncan, Garner.